And with that, good evening, Bobcat Nation. Welcome to another edition of the Bobcat Blitz Sports Update. My name is Sean Kirkpatrick. Little bit of a change of scenery. I was trying to get to a different location. We're going to reveal that in just a moment. But due to the cell phone reception, I had to come back into City Hall, which is always a nice place for me to hang out. I want to thank you for joining us tonight. We're going to have John pop on a little bit here. He's busy with his grandchildren, being a devoted and loving grandfather. Can't fault him for that. Before I begin, guys, can't stress enough the history that just happened here at Northport High School on Friday and Saturday. I know John and I have been hyping the cross-country event for several weeks. We've been hyping both the men's team and the women's team as well. Wow. Unbelievable. 90-plus schools, 2,000-plus athletes. Again, if you have not heard by now, the largest ever on-campus 5K cross-country event in the history of the state of Florida. That's including some majorly large high schools out there. I know Dr. Phillips out of Orlando, that used to have 4,000 kids. So, schools like that, we still brought in more. So Coach Duque, Coach Fu, we're going to talk a little bit more about that later on when I get you on, hopefully next week, and talk about all the great successes you had on there. But tonight, we are actually going to shift gears. My guest tonight actually is going to have two parts. You might not know this. The first part is the lighter side, and it's the athletic side. The second part is going to be the medical side. And for those of you who were not here last year, we do have 1,000 new members since we did this last year. Some of you might not realize that about 2-3 years ago, this town had a lot of trauma at the high school age in terms of mental health issues. And, of course, many years ago, we had even another wave. So we reached out to our next member, our honorary medical correspondent of the Bobcat Blitz, and it ended up being one of our most watched episodes of the year. And I asked her nicely to come back, and she agreed to do so. But we're going to get to that part in a minute. Let's get to the fun part here. Miss Olivia, I'm going to call you Coach B. How are you doing today? We'll save your medical thing for just a minute. Introduce yourself to the crowd. What is your role with cross country? What is your role with running? And why in the heck was I at Myakkahatchee Creek earlier today? There's a reason why I went there. We couldn't make it happen. What's going on, Ms. B?
Yes. So hi, my name is Olivia Bonevento. I am a coach for the Imagine high school and middle school cross country and track team. Go Sharks. My kids affectionately call me Coach Liv. So
okay.
If you want to shift gears to Coach Liv.
That's easier.
I've been running for the last 9 or 10 years at an adult level. I have ran 6 marathons, and I just qualified for Boston in October at Chicago. So I will be running that in 2026. I just got my official email today. I am very passionate not only about the cross country and track space, but also about the mental health space. I am an advanced practice nurse, and one of the certifications that I hold.
Coach, hang on, time out. Let's go back. Hang on, let's unpack something real quick before we get to that part. Coach, what?
I was introducing myself, my friend.
That's part 2 of our show. This is part 1. Part 1 is just the running part. We're gonna get to medical in just a moment here. Let's go back to your coaching here. Hang on a second. Hang on, time out.
You got it. So,
you are a coach. Now, I don't know if you've seen our earlier episodes, but we have for 2 weeks now with our cross-country teams, we've all been hyping how, unlike other sports where you have foes and rivalry, cross-country tends to be more forgiving and loving and nurturing.
Oh, of course.
And I want to say, personally, a year or 2 ago, I forgot which July 4th it was, but the Imagine parents, the cross-country parents, they came out and helped.
Yes.
Coach Fu, the July 4th fundraiser. And before people get mad at me for letting Imagine be on our show, I only thought it'd be fair. You deserve the credit for coming out and helping us.
Yeah, thank you.
We wanted to help you. What do you have coming up?
So we have a great event coming up next Sunday, October 5th, at the Myakkahatchee Creek Park in Northport. I pronounced it right. I'm very proud of myself. That was going to be a struggle. We are having a poker run, which is a very, very cool concept that has been created by my head coach, a Coach Q. It is going to be a run where the runners over the age of 18 essentially get to play poker. So at the middle of the race, you pick up a poker card from the table. You get to the finish line and you hand in your card. Best hand wins and worst hand wins. A little bit of money. So it's a lot of fun, and we are very excited. All of our kids actually volunteer for the race. So instead of running the race, our cross-country kids kind of get to see what it's like to be behind the scenes and help out, which is absolutely fantastic. And we have a great, compassionate, and just top-tier phenomenal group of children. Like, I could not be more blessed to be their coach if I tried. I'm very proud of all of them. So it's going to be a really great event. The registration is available on Run Sign Up, Sean. I'm sure that you can put that somewhere here.
Yeah, we'll post it. Yep.
To some capacity. But that is, again, on Sunday, October 5th. Fingers crossed for no hurricanes or anything crazy.
And you know, Coach, again, we want to help Imagine. We don't want to help them too much. We want to help them just enough.
You do. Yes, you do.
We want to help you just enough. And you're not done with that. You decide to be a race director of 2 more races, I believe. You have their local. I think one's over at Ann Devers Park, which is Inglewood. And then there's a third one with Awaken. Northport, we know about Awaken because they always do their weekly fun food drives. It's a big part of our town, their involvement. So,
so I'll go into both of those. Yeah, I'll go into both of those. So I am the membership and marketing director of a running club here called the Zoomers Running and Triathlon Club. And we host a race every year called the Trick or Trot. Last year, unfortunately, due to the hurricane, it was rescheduled to December. But this year, we are looking good, hopefully, for October 18th, which is a Saturday. It's a really fun race at Ann Devers Park in Englewood. It is a costume optional race. You can bring your family. It is a trail run. And we have some great sponsors bringing out some food as well as a coffee truck there. We definitely would look forward and appreciate everybody's support there as well. And then for Awaken, that's on October 25th, the next weekend. I guess I've overloaded myself in October. But that is October 25th, and that is for the food bank in our area. So Awaken's 5K will directly help to raise money to support the local food bank, which is something, you know, as a Northport community, I think I've really found over the years that we're very passionate about helping other people and really bringing that out. So this is a great cause as well. If people want to come out and support the food bank, there will be raffles and gift baskets. I'm not especially sure what's going on in terms of what's in them, but that could be a surprise for all. And we would definitely appreciate your support there as well. We will find a way to post all of these on Run Sign Up.
So, Coach, before we get to the meatier part of it,
yes, of course.
So you also were at the Bobcat Invite on Friday with
I was.
What were your overall thoughts? I wasn't there. I was only there for Saturday. I was not there for Friday.
Yeah. So what was the question, Sean? I'm sorry. I didn't hear you.
Thoughts? Have you been there before?
Yes. So I actually went last year as a spectator. I have a running family that means a lot to me that I've supported over the years. They know who they are if they're watching. Yep. But I am there this year as a coach, which was absolutely spectacular. I mean, compliments to Coach Fu, as always. He puts on a phenomenally run event every year. Everything really went, honestly, for the most part, without a hitch. Pretty seamless. It was a great race. A few of my kids achieved some PRs. My senior, Kane Roser, achieved a top 10 placement. He was number 10 on Friday night. So for the boys, which was great for him. And I am so very proud of him. We had some great personal bests for the season as well. One of my girls, Elin, had a PR for the season. So, you know, and we also had Cole had a PR for the season. Peyton had a PR for the season. I don't know if they're going to be mad at me or happy that I'm shouting them out, but I'm very proud of all of my kids, truly. Like, we had a great time.
Coach, this is not only was the event historic, but this episode already is historic. We've never, ever given a shout out to anybody from other schools. You let your kids.
So I guess my kids are the first ones, huh?
Are only because our next segment, you are also our medical correspondent. Met up last year over this topic.
Yes.
And I wanted you now to switch gears, if you don't mind. Back in the old days, the TVs would do these wiggly lines. Like,
Yeah.
so we're going to do that.
Yes.
Our next guest, we now are going to the medical portion that was
Yeah.
very viewed last year. So if you don't mind switching over, give us who you are, what's going on with September, and why do we ask you to come back here for this?
Sure. So I met Sean a few years ago at a race, and we just connected with the premise of loving running and loving the running community. Then I think, Sean, we started connecting because we figured out that we are also both medical, right? Don't you have medical background as well?
I'm an RN right now.
Yes, I thought so.
Company yet. But my population is 65 and over, however, not so.
Yeah.
A little different than you.
Yes. So I am an advanced practice registered nurse. I am in the field of pediatrics, which is an amazing field. I mean, I've always, since I was a little girl, wanted to be a pediatrician, and I put that out into the world, and I went and got my advanced degree, and here I am. I get to coach every day and be with my kids in the morning, and then I get to go and take care of my kids in the afternoon as well, which is a blessing. I get to be surrounded with what I love every single day. And that's really essentially why I'm here. I have a certification in addition to being an advanced practice nurse in developmental and psychiatric health. And Sean has asked me to come onto the podcast because I have a lot of passion for mental health and, of course, Suicide Prevention Month and mental health advocacy. And if anybody doesn't know, on this space, September is Suicide Prevention Month. Right. Which is a very heavy month for some and a very beautiful month for others, really depending on what their life story and what their experience is. So that is why I'm here today.
So I'm going to call you Nurse B. So Nurse B, so I tried to, we got cut off earlier with the camera situation, but a couple years ago, this city had a pretty bad spate of mental health crises with our teenagers.
Okay.
And even many years before, we had, famously was on TV, we had another wave of that. So we weren't sure last year what it'd be like talking about this topic.
Yeah. I remember you being nervous. I remember you being very nervous, and I was nervous too.
But we got a lot of positive feedback. People actually thanking us for not shying away that not all life is roses and sunshine and candy all day long.
Yeah, exactly.
Life is lived in the gray, right? It's not all white and black. There's a lot of heavy things these kids are going through. So again, thank you so much for coming on today. I guess my first question would be, or you can go in any order you want. As a clinician, they just, even as much as last year, have you seen a difference in the rate, the number of kids having their own personal turmoil?
I think that's a question that is very loaded. From a statistical standpoint, the last few years have been very significant because the rate of young adults between the ages of 12 and 19 that have experienced depression, anxiety, suicidal ideation has gone up significantly. It actually is 20% of children between the ages of 12 and 19. So that's a pretty staggering number. But then again, you have to think about, a lot of kids are not saying it. When we as clinicians do assessments on our patients, particularly in the pediatric space, we often will ask the parents to leave the room for sensitive topics. Are you participating in any activities you shouldn't be participating in? Are you feeling depressed, anxious, etc.? And what I found as a clinician is that the kids are actually likely to say something to you when they don't feel that the parents are looking at them in the eye, which is unfortunate, because I think that mental health is often really stigmatized in our society. And since a lot of kids aren't speaking, the true burden of mental health really exceeds the rate in which it's being reported at.
I've got a lot more years on you. My blue-collar upbringing, terribly anti-mental health awareness.
Yeah.
It was reserved for two branches. You were either crazy, bipolar crazy, and they locked you away.
Sure.
Or you were a very bored, rich housewife with nothing to do but complain. That's how my parents, or not my parents, but that's how my generation.
Yeah.
Sadly, that's how they viewed mental health. I have since obviously grown wiser over my years. I have always wondered, why do we push yearly physicals, but we don't push yearly mental checkups and our insurance, things like that? But your kids are a little bit different because they you know, their bodies are growing, their minds are growing. They have a lot different factors of addressing them. Say my senior citizens, they're at the end of the life type of thing. Yours are at the beginning of their life. And they've got so many things that I didn't have to worry about in the 80s growing up. I can't imagine being a teenager.
Oh, yeah. I mean, the burden of social media, the burden of comparison, these kids are constantly on their cell phones with absolutely sometimes no view of the outside world except for right here. You know, that makes things extremely difficult. I love that my cross country kids are up every morning with me for an hour and I really don't see a phone. You know, like that's a really great thing. We have great conversations, we connect, like we have fun, we laugh, you know, like that's really what it's all about.
Yeah. So this show we primarily focus on athletes.
Yes, of course.
Student athletes. So I kind of want to angle just, you know, again, I don't want to ignore all of the students.
Of course.
Do you see anything different with the athletes, better or worse? I'd imagine you get.
I actually would say worse. And I think that's for a multitude of reasons, right? We always encourage our kids to be well-rounded, right? To kind of be everything and anything all at once. And I think when you have a really great student, it's wonderful. You know, when they have great grades, they're doing well, that's awesome. But when you add athletics into the mix, it gets sticky and the pressure is higher, you know? Because the risk factors for a child to have depression, anxiety, et cetera, is always that academic stress, family conflict, if they feel socially isolated at school, sleep problems. But, you know, there's a lot of athletic specific things that can occur, like injuries. You know, we see a lot of kids on our teams get injured and have to go into rehabilitation. And we watch them kind of crumble from the inside out because a lot of kids really define themselves and their worth on how good they are at their sport, you know? And when that's gone, they don't really know how to navigate the next steps, you know? Loss of playing time, you know? Like if you have a junior who has been there for 3 years and suddenly we've got a star freshman coming in who blows everybody out of the water and this kid's playing before the junior, that can make a junior question, am I good enough? You know, losing playing time, coaches sometimes don't think that that's a crazy big deal because they are trying to do what's best for the team, which of course, in essence, you know, is always what we want to do as coaches. But sometimes we don't understand the consequences that may come about with that. A big one, especially with my kids with cross country and especially with myself, overtraining. I think that we definitely put on emphasis on more running, more soccer, more baseball, go to the batting cages, go to clinics, get up and do 5Ks on a Saturday. Like even if you had practice all week, these kids are constantly working their bodies, and it gets to a point where that physical exhaustion can sometimes translate into mental exhaustion. It doesn't happen all the time, you know, but it's definitely something to watch for. I would also definitely say weight and body image. I think that the expectation of that varies by sports. My cousin Landon, he is a Northport High School wrestler, you know, and I've watched him cut weight more times than I could possibly imagine over the last, he's a junior now, 3 years of school, you know, like it's a lot of pressure to get to where you need to be to perform how you need to perform. And I think that those kids do feel that. And then I also think, you know, like scholarship pressure, the pressure to go to college for your sport. A lot of parents, even more than the children, want their kids to go to college for the sport that they've played their whole lives. And that translates onto a lot of pressure as well. We forget that these kids are not in a world anymore where after practice is over, they turn off their phones and they don't hear from their team. They don't hear from their coaches. They don't have to look at videos of how they did. we have constant reminders of our kids on what they're doing, on how they're doing, on what they're doing wrong, on what they're doing right. We have videos, we have the Game Changer app where I talk to all my kids, like we're constantly connected, but it comes to a point where that's a detriment sometimes, I feel, not a positive. So I definitely think those are some of the things, especially in the athletic space, that are especially relevant when it comes to the risk factors for mental health.
One of the topics I'm glad you brought up, and I wouldn't say I got in trouble with this, but I kind of left coaching for this, and I might get in trouble for it now.
Oh, no.
I didn't like the all year aspect of where a lot of these teams are going with.
Yeah, I get that.
And the mentality is, well, if you don't do it all year long, you can't make the varsity or college. Right.
Yeah, I agree and disagree. Yeah.
Parents they'll wall it up and say, you're wrong, Sean. I'm like, I'm just saying my youth, I was never an all-star, but there was, you did your sport, you took a break, you played something else, you cross-trained, you weren't burning out.
Right.
Because the parents might not realize they're putting all this money into these sports.
Yeah.
From the time they were kindergartners, they're putting all this money in their sports, all the leagues. Like you said, they're filming them at their games, they're filming at practices.
Yeah.
It's too much. And a lot of parents don't want to recognize that and say, oh, yeah, no. The
all year aspect, there is a point where I agree and disagree. I think that there needs to be some degree of self-motivation for kids. I think that there's a lot more power, and this is my coaching philosophy. It's actually something that I really try to bring forth in my life, is that what really matters most is what you do when you are not required to. And when no one is watching you. And I think that that's really what defines a true athlete. You can have required practices all year long, right? But the kid that might not go to every single one of those, but do a workout or two on their own once a week, that sometimes makes a difference. I think that kids need to be a little bit more self-sufficient and not always depend on that, oh, you have practice Monday, Tuesday, Wednesday for 7 months straight. I think there needs to be a degree of them wanting it too, without there being a schedule, if that makes sense.
Oh, it does.
That's kind of where my coaching philosophy is. I'm more proud of the kid that will go and do the extra work. Like this year, I gave all of my kids at the beginning of the cross country season custom workouts tailored to what their 5K time wanted to be by the end of the season, or what I thought was a reasonable benchmark for them, right? And I gave it to them. Do I know if they're doing it? No, I don't actually. Am I asking them? No, I'm not. I probably should be, but I'm not. You know what I mean? I'm giving it to them. I'm placing that in their court. If they want to do it, awesome. If they don't want to do it, okay. But you know what? The kids who might be doing it might be the ones that are achieving the personal records. So I think that it's really all about you wanting something too.
Well, I think I got a little bit more slanted the other way on what I've seen over the years with high school, the bigger schools. But I do want to go back a little bit. You talk about parents, put the pressure on. So let's go back to what you said when you first have your assessment. Let's say a new patient comes in. Let's say the kid, and I don't care if it's a male or female. Let's say they're him and Holland with mom and dad there. You put them out of the room.
Yeah.
What signs and symptoms are flagging you to say, hey, look, this is so parents can learn. Like, hey, wait a minute, my kid never did it in front of me. I never saw that, because they might not be tuned to it. They might not be looking for it.
So Sean, you're not going to like my answer. I don't think that there is any. And I think that I'm saying that because through my experience as a clinician, I think that depression and anxiety presents itself very differently depending on the kid. It's not about the symptoms, right? It's not about them coming in the room and how they look. A lot of people associate depression with bad hygiene. anxiety with the fidgeting in the seat, the foot tapping on the ground, the panic attacks. But the thing of it is the kids might not be presenting that to me. You know, it's about how they answer the questions. It's about how they react to certain words that I say. I'm a talker with my patients, and I'm a talker with my kids too. They'll definitely agree if they're watching this. I love to know my cross country kids, like outside of the running space. Like I love to know who they are. And as a practitioner, I really try to also know who my patients are. You know, I look at them and I ask them about school. I ask them about their friends. I ask them about if they're having issues paying attention. I'm asking them about sleep. And as you kind of ask them these questions and you kind of get a little bit of a roadmap of their life and what they're going through and what they're dealing with, there are like a little small little signs that we might have an issue, right? Like number one, lack of friends, lack of connections. Oh, like what do you do outside of school? Nothing. Oh, so at home, like, do you play video games or anything? Do you read? No. I don't like to, like, you know what I mean? Like the answers like that.
Those are the answers. I know. That's a problem. That's why.
Yeah, but those are the answers that I'm like, okay. Or so like, are you having any issues with your sleep? And then they look at you with the big eyes and they like nod. And you're like, okay, like what's going on with your sleep? And they tell you that they sleep an hour a night. Or they have such racing thoughts that they can't go to bed. You know, it's really all about what you ask, how you ask it, and really just meeting every child where they're at. Like I remember having a young boy a few months ago. He was, I think, 14, 15, freshman in high school, I believe. And I'll never forget his mom taking me afterwards and saying to me, this is the first time he has ever felt comfortable speaking to anyone about anything. And you're getting him help. Thank you so much. And you know, at the core of it, that's why I do what I do, is that I just want to make every child that I come across, whether it's on my team or it's in the office or in the hospital, I just want every child to feel as if they have a place and a value. And I think that that's really it, Sean. Once a kid feels listened to, it opens up a world of possibilities to help them, you know, and that's really how I feel.
You know, I think another stumbling block you might bump into in your setting.
Yeah.
A lot of students as well as parents are afraid that if they do open up to you, first answer is put them on Ritalin or antipsychotic.
Oh yes. So I'm also somebody that is not the biggest fan personally. I am somebody who really tries to go every other avenue first.
Yeah.
Therapy, cognitive behavioral therapy, school accommodations, you know, like if a kid's having an issue with inattention or test anxiety, let's give them a diagnosis of anxiety and give that to the school so they can have a 504 or an IEP. You know, if we give them a diagnosis of ADHD, in the neurodevelopmental space, you can. At a general practitioner's office, you have to send them for a referral, you know. You send the referral. You understand what the kid needs from your assessment of them, and you kind of go from there.
Can you still hear me? Sorry about that.
Yes.
Thanks. Sliding down. There's cars everywhere. Sorry about that. All right. Just a second here. You know, when I first got into teaching, I'm no longer teaching now, but I first got into teaching back in the mid-90s. Was a problem. I noticed the kids who were on Ritalin may not have need to be on it, and they were class and snowed under, and then there was a big rebound in the early 2000s. Let's not do any meds at all. So I don't know, at your point in your career, has there been a better balance now? Because I think it went from one shift to the other. I didn't know how you're seeing it.
I think that we're not medicating as much, which I think is a positive. Again, I'm not looking to insert my full medical opinion. on the podcast. But the one thing that I will say is I think that there needs to be a degree of, let's not pump a 5-year-old with ADD pills.
Right.
You know, let's not put a 14-year-old on 3 different types of medications. You need to be really strategic with what you're doing. I am a believer in medicine. You know, if I wasn't a believer in medicine to an extent, I don't think I'd be here.
Right.
You know, I don't think that I would be the nurse that I am. I don't think that I would be the practitioner I am. And I really don't even think I'd be on this podcast. However, I think that there needs to be a balance between medicine and more therapeutic modalities.
Well, I also like what you said about getting active with the school program, like the 504 plans and the IEPs.
Yes,
and, you know, one of the things I've bumped into as a teacher is it really depends on the district itself. We had a school psychologist who would rotate from campus to campus to campus. I forgot his name, but really nice gentleman. And some districts don't have that luxury to have them come by. And I always felt bad for the kids. It's like everything else in life. If you don't have the resources, or you don't have parents who don't know where to even begin, how you get that first step. So what would you say to people watching? What would like not easy, but a good starting point as a parent? If I'm watching this, I'm going, man, you know, my son or daughter showing this sign, maybe I should reach out. Where would they go to something like this to get started?
You know, it's so hard, you know, because the biggest key to it is a good practitioner. You know, like a practitioner that really listens to you and to your children and that doesn't write it off. That's a big thing. So I feel like, you know, every parent kind of has their preferences. And for me, I would definitely recommend that you go to your general pediatrician first and express concern. Because, you know, at a general practitioner appointment, they will always do a depression screening on a child over the age of 9. So if there is anything that indicates mild to moderate depression, anxiety, etc., because there are anxiety questionnaires as well, like based on what you tell us your chief complaint is, like what your concern is about your child when you come into the office, we can fine tailor things, you know, to what we think might be happening. And, you know, while we can't give, they have depression from a neurodevelopmental point of view, we can say, this is what we think. Let's refer to therapy. Let's refer to psychiatry. You know, like let's get them to a spot where there's a whole team. I think that mental health and anything that has to do with children is very collaborative. You know, that phrase, it takes a village to raise a child. Very, very relevant in my space, in the coaching space that I'm in, as well as being a practitioner. You need to have a team of people behind you. It's the general practitioner, it's the therapist, it's the psychiatrist, it's the school. If it gets there, you know, you might have a kid come in, and forgive me because I feel like this is a terrible example, but you know, like you have a kid coming in feeling really, really down, and you find out that they broke up with their boyfriend. And you're like, okay, well, all right. Like, you know what I mean? Like, okay, I don't think that we necessarily at this point need the therapist, need the psychologist, like, you know, like we don't need that. But then if we have, I'm not sleeping, I'm not eating, I don't feel good enough, and the list goes on, then let's do some things and help this kid, you know, like let's make this kid feel joy and happiness again, because every person, every child deserves that.
You know, I was going back in history of my own. I actually had a school age friend who had suicide intent. He actually tried. And I won't tell you what county it was in. I'm thinking right now, we just opened up here in Northport in a
the behavioral health one, the behavioral health place.
Now, I don't know if that's going to be open for teenagers, but I'm just, have you bumped into crises yourself that required intervention at the legal level or the police level?
I have a few times. And it is a hard subject for me. Personally, my brother's best friend, unfortunately passed by suicide when he was 19 years old. So And I'm only 3.5 years older than my brother. So it was a very, raw, sad. It's a week that I think probably ranks as the worst week of my life. Between having to get him home from his freshman year of college, to navigating the funeral, to being the big sister figure to 10 boys who had no idea how to even begin to process. It was a very dark and sad time for me personally. And it still very much impacts me when I do my work. And, I think that crises are inevitable given the world that we live in. Yeah. But I think that they need to be met with a lot more compassion and grace than they currently are. From a pediatric level, I haven't seen as much yet. I did work at Sarasota Memorial for 4 years on a pretty high acuity floor. So that showed me a lot of crises on that level, that we had to go a lot further. But I think that from a pediatric space, I thankfully haven't had to address it yet. I've had to address it in my personal life a lot more than I've had to address it in my professional life at this point.
Well, our theme way back at the very beginning of the episode, we were talking about athletes and depression.
Yeah.
We, of course, didn't mention the positive of athletics with depression. But what would you say to counter all this? Hey, students, if you go into athletics, this is going to help you mentally by what? What would you say to the parents?
Well, first of all, the teams, for the most part, I mean, listen, I might be biased. Sorry, Northport, but I think that I have the best team. So my kids are great. They lift each other up. They cheer each other on. They're supportive of each other. We have no policy for anyone being unkind to anyone else. My kids know that. We have a very high expectation of respect and kindness and hard work and teamwork and compassion. And I think that my kids really exhibit that every day. And I would say to a parent, let your kids be a part of something bigger than themselves, because that's what athletics is. It's something bigger than them. It's a community. It's a place where they learn such key life lessons: resilience, teamwork, work ethic, building each other up, sitting there and dealing with trials and tribulations, learning how to navigate failure, learning how to navigate maybe negative thoughts and feelings with people by your side, knowing that your team is your family, because I do think that my kids are very much a family. And if one of our kids was in trouble, I know that all of my kids would help. And that's something that I think is very valuable. And I've seen that as a person who is friendly with Coach Williams and Coach Warnke and Coach Fu over at Northport. I also know that they have a phenomenal team of young men and women as well on the cross country team. Just great. And, watching my cousin Landon wrestle, they really just have such a great community of kids. And I think that that's really the core of it, is this is a community that will really last your children beyond. And the lessons that they learn will also last your children beyond. And that's what I think the core of it is.
So, before we wrap this up here, Nurse B, I want to tell you something I saw Saturday, and this speaks to what athletics can do for positive mental.
Of course.
So towards the end of the races, that's the hottest part of the day. Those are the gym heats. They get a little slower, and they're hot. They're not as experienced. I'm in the backside area, making sure they go the right direction. And I saw other athletes from other schools, obviously varsity runners. You can tell the difference. And they're out there. No one's looking, cheering on these younger runners. They didn't have to be there.
Of course they
could have the 10 other buddies. I saw so many schools coming over and helping get those guys in, and including the cadets, RTC cadets, walked some of them back. So you know, it's just nice. There are a lot of positives. I don't want to sound like I'm bad mouthing sports all day. Trust me, I'm not. I'm a huge sports fan.
No.
Find that balance, just like you said. We got to find that balance. So, Coach B and Nurse B, let's go one last time. Speaking of positivity, one more time on those races, because that's a great place. Even if you don't run, you can walk it, can't you?
Absolutely, yes. So I'll just recap the races again really quick. So myself and my head coach of Imagine, Coach Q, we are holding the poker fun run at the Myakahatchee Park on October 5th. It's a Sunday. It's a poker run. You get a poker hand in the middle of the race. You take your card, and when you finish, the best card wins and the worst card wins. My kids will be volunteering there. It is a trail run. It's guaranteed to have a lot of fun. We have Los Dos Cristianos providing us coffee, as well as First Watch providing us breakfast. So we've got some great food and hopefully some good poker hands there. And then the Zoomers Trick or Trot on October 18th, Saturday, October 18th. It is a costume optional Halloween party at the Andover Park in Englewood. We would really appreciate your support there. There will be a coffee truck, a costume contest. Come on out and have some fun. And then the Awaken Outreach 5K on October 25th. That's a Saturday. That is for the food bank. So every fund that is received for that 5K will directly help feed the community of Northport, which what's better than that? That is at the, the Awakened Church off of Flamingo.
Okay, yes. Gotcha. All right, the whole 5K. Okay, gotcha.
Yep.
All right.
Yep. And I don't know if we're able to provide the run signups when we get off of here, Sean, but I can try and do that for you.
Oh, yes. You'll give me, I'll put it on there. So before I go, again, September Suicide Prevention Awareness Month, excuse me, I should say.
Yeah.
Thank you again for tackling this topic. Like I said, this school has a lot of history, unfortunately, tragic history, this area with our youth. And I feel like the more we discuss it, the more we don't put shame to this topic.
Right.
That's the only thing to get better with this and how we treat it and all that. So I want you to come back on later in the year, because we could take any one of those branches and go with it, with the social media, with the eating disorder.
Any topic that you want me to dig deeper on next time, I'm more than happy to.
Yeah, awesome. All right, fans. I want to thank Miss Olivia Bonevento, Coach Liv, and Nurse B, all in one episode. What a great job. That's a lot to tackle for one episode.
Yeah, I don't know how we did that in 42 minutes. I'm pretty impressed.
I talk a lot. I give 5 hours on this. That's okay. All right. Well, fans, I want to thank you for joining us tonight. I am sorry we couldn't make Friday's review game, but I got great news for you, fans. We will be at Braden River Friday night. That's a 7 o'clock kickoff. I want to thank all of our fans for voting yes. Less than one day, we got those 50 votes needed to get me up to Braden River. Thursday night, however, I am actually going to do a cameo. I'll be back at the volleyball game. I've not done any volleyball games this season. I'll be helping announcing them as well. So a lot going on here at Northport High School. I will see you next Tuesday on the Bobcat Blitz Sports Update here on Facebook Podcast. I want to thank CBRA, Community-Based Radio Association, for helping us out on tonight's episode. On behalf of everyone here at Bobcat Blitz, take care, stay safe, talk to your doctors. They know a lot. They can help you. Please, folks, listen to what they say. Have a good night.